Hi guys, and welcome to Life Unedited with your host Samantha Limo, and welcome to Episode 3 with my special guest, my sister Gianna Limo, where we will dig into balancing life and school as a nursing student. Welcome, Gianna.
Hi guys.
So, can you just share a little bit about yourself?
Hi guys. So yes, I'm a nursing student. I just finished up my first semester and I'm starting my second semester in like 2 weeks or so. I'm very excited for what's coming for the next semester, but besides that, I'm 21 and I just like to spend time with my family and stuff like that. So second semester nursing school starts on the 23rd, and I'm hoping for a good semester, but I know it's going to be very challenging. But I think it will be very nice to learn things that are more close to what I want to do in the future.
You got this. So, let's dig in, G. What inspired you to pursue a career in nursing?
So actually, nursing wasn't always the first thing I wanted to do. I kind of wanted to do a bunch of different things, like especially starting when we were in like high school. I was always thinking, oh, should I do like a forensics type of thing? And nursing was always in the back of my mind, but I actually never thought I was smart enough to pursue it and really do it because, as we know, nursing school is very, very hard. It's very time demanding and all that stuff.
Yeah.
And I just never really thought I had it in me to do it. But finally, once I went into college, I just kind of did psychology as my major. I just kind of worked through that first before I said to myself, okay, you know what? Let's do the prereqs. Let's try it out. And I wound up really enjoying the prereqs as well. And then I was like, okay, full blast going into nursing school and got in. And yeah.
And back to what you said, like you didn't feel like you were smart enough. You are smart enough. And I feel like with nursing, a lot of people think or really anything in the medical field, that they're not good enough or smart enough. And it's really, the classes are so demanding and so hard. So I feel, you have to have a certain grade to pass. And if someone doesn't succeed or get that grade, they automatically feel like they're a failure. But in reality, like they really are smart. Some people aren't good test takers.
Yeah,
and no one really sees that. Like professors don't see that. I feel like in high school they help you, like, if you're not a good test taker and so on, but I feel like in college they don't. I'm sure there are places in colleges that offer the help for students that do require like extra time or anything like that, but I know for myself I'm not a good test taker, so if, to take big exams is like horrifying.
It's bad.
So for any like students out there who want to go into these types of fields, like do not put yourself down, really give it all and really try your best and keep pushing forward and don't give up.
I definitely like what you're saying because it wasn't always oh, I passed. There were like 2 or 3 tests where, especially in one class, where I just really couldn't pass a test, but like it's passing in my mind because it wasn't less than a 60, less than a 65, but for my nursing program, I have to have a 77 or higher on any exam in order to pass. So I got a 71, I got a 70, and they have to speak to you, they email you, they kind of set you aside from the class, and it makes you feel like, oh wow, maybe I can't do it because, if I were to normally get a 75, it wouldn't bother me, especially in high school, it didn't bother me too much. But now it's really like, it's very weird to say this, but it's kind of like do or die in the nursing program.
Of course.
But yeah, it's very demanding. You have to have a lot of time. And I know what you said about the test taking skills. I was never a very good test taker, and I feel that during this program I definitely got better at taking exams because it was just kind of the normal. We just had an exam all the time. So
you got used to the
studying and knowing the question styles and things like that.
So can you walk us through a typical day in your life as a nursing student?
Yeah, so basically, our day starts at 8 a.m. all the time. But depending on your clinicals and stuff like that, you might have it at a later time. But this semester, my first semester, we had 8 a.m. and I was there basically every day, Monday through Friday. The only day that I did have off was a Thursday, but we had some people did have class on Thursdays. Um, Basically, it was 8 to 12, and then right after class would end, we would go straight into our clinical building, and we would have clinical from like 12 to 3. So each day definitely did vary, especially depending on the class.
Mm-hmm.
I actually did have a night class last semester too, which was my pharmacology class, because we had pharmacists from the hospital teaching us. So that was at night. It was 4:30 to 7:30. But other than that, every class starts at 8 a.m. We're there from 8 to 12 in our big lecture hall. Something that kind of bothers me about nursing classes is that we don't really get breaks in between our classes, so it is very
all day
it's really just all day, and it gets to be very draining because you're sitting there, you're looking at the screen, listening to these teachers speak, and they have such great insight on nursing and nursing care, but you're sitting there from 8 to 12. They give us like a 15-minute break, let's say, and you just go right back into it, right where you started off, and I'm like usually very hungry, I'm usually very thirsty. We could drink water, obviously, but it's very hard to have snacks in class, and basically my meals are just based off snacks. It's crazy, but
oh my goodness.
Yeah.
So within all that, how do you balance the demands of nursing school, work, and your personal life?
So I have to say I do kind of struggle with this because my first semester, the thought in the back of my head was that I just don't want to mess up. So I really strictly put myself into the books all the time, and in a way, I still had time obviously for my friends and my family, but there were times where I would like disassociate from like a lot of stuff because I'm like, you know what? I need to do this. I need to be there to study, and I have to do it. Like I would spend weekends at a time in the library, and I wouldn't, like I'd get there for 12 and I wouldn't get home till like 8 o'clock. Just because, like I said, I keep going back to like how important it is to pass, but that's really just what's in the back of your mind. So it is really hard. So I am definitely struggling with the balance of that. I'm hoping that I get a little bit better with that, but there were times like after an exam, I always set it aside for myself. Like when we would come back home from school, because after an exam we would go straight back into lecture.
Okay.
We don't like end class like a regular college class would be. We go right back into learning again. So when I would come home, and if I didn't have anything really important to do like the next few days, I would come home and take a nap and just kind of decompress because
yeah, of course,
it's a lot. Yeah,
it's a lot mentally as well. So you have to decompress. You have to give your brain a break for sure. And I'm sure it's very hard to balance everything because even with like, family, as your sister, there's been times where you didn't come to like family events because you're studying for a big exam that's coming up. And, like we have other family members who have been in the medical field and they didn't come to like certain vacations and, they missed out on events. But I guess in the end, it's worth it.
It's worth it, but like it hurts to not be able to go to things because it's like, oh, I'm really not going to go because I have a test.
Yeah.
And it sucks because I think of it like as, oh, what if like I never see this person and like things like that.
You think of it that
and
way,
it's so hard, like, oh, I haven't seen them in so long, like what, like the what if is always
and that's understandable
in the back of my mind, which is not a really good way to think, but it's just always there. So.
Which I get, and it is like hard to think like that, but just think of it as well, like then you went and you studied your butt off for that test, and then you passed.
Yeah.
And then you can now go see your family like on the weekend or whatever day works for you. What for you has been the most challenging part of studying nursing so far?
So nursing is very, like our exams, I'll say, nursing is not very much textbook style. It's really, you can't study to memorize, you have to study to understand. And in the beginning of the semester, that's something I definitely struggled with because for other exams in my prereqs, you would study to just memorize it and just know it for the exam. But for nursing, you take what you learn in your very first semester and it goes to your very last semester. So you have to really study the material, but not just study it, you have to understand it. So like there could be questions and you can know the term, but you have to understand it because every single person is unique. It's not going to be the same. You could have the same underlying issue as I do, but it wouldn't be the same in the
And that's a good point that you brought up. Like, you said it's not just studying, it's understanding it,
yeah,
right?
Not studying to memorize, studying to understand is what really has helped me.
And I think that goes for really anyone studying in school. Like, you could study, but sometimes you don't even grasp what you're learning, or your professor could talk on and on and on for however long certain schools' lectures are, and sometimes you leave that class and you're like, what did I even just, like, learn? And I know your classes might be shorter or some longer, and, not everybody grasps and understands that's the same topic the same exact way. And I feel like a lot of professors think everyone handles it the same way.
Yes, and they hold very high standards.
Yeah, and they, like, not every student has the same learning capability. And, I mean, I can only speak from my professors. They do understand, because my field is like that type of field.
That's amazing. Yeah.
But, sometimes after some of my classes, I'll go home and I'm like, what did I even just, like, learn? And it takes a toll on you, because then you're like, how am I going to know what to do when I graduate and I'm actually in the field? And what stood out to me from a lot of my professors, and I don't know if your professors say similar things, but they literally say, like, your main learning is when you really hit the field.
Yeah. You learn a lot of stuff once you're on your floor, which is the main thing that they like to teach us, especially, like, every class I have has a clinical. So it's also, like I said, you have to study to understand it, because then you have to actually apply it when we're in the field.
And I'm sure you probably grasp more in the clinical aspect, because it's hands-on. Yeah. And believe it or not, a lot of people are hands-on learning.
Yeah, me too.
And that's why, like I said before, like, not every professor understands that. Like, they always used to give, like, those quizzes in school, like, with all questions, and what type of learner are you? And you'll know at the end of this quiz. But it's like, sometimes you get one, and then you're like, but I'm really not that type of learner. Like, I need to, like, repeat it to myself over and over. I need, like, the teacher or professor to, like, put it up on the board and show me, or honestly, like, put an example out in the room, like, so we could understand it. So, there's a lot of things that come with it. But now, what would you say has been your most memorable clinical experience so far, or just nursing experience so far?
So the first week that I had in the nursing home, which was my first clinical, I had a really, really sweet patient. She had a little bit of dementia. Okay. And as we were taking care of her, we have to like ask questions and try to get to know them a little bit, because you want them to be comfortable. Nursing is all about having your patient be as comfortable as possible and things like that. So she had pictures all on her walls of her family, and it seemed like she had, like, grandchildren and stuff like that, so we were asking her. And it's really sweet how memorable you can be to a patient, especially in a nursing home, because I feel like nursing homes, they really don't, like, they're there just to help them and take care of them, but they're not gaining relationships with them. And
which is sad, because some of them are in there long term.
They're human too, and they deserve to have that relationship aspect.
Of course.
And especially, they don't want to feel isolated, so that's the least thing that I ever want to do.
Especially the people that are cognitively still there.
Right. Oh, yeah,
and can understand what's going on, and to not give that relationship is probably so frustrating.
It's so isolating for them. So it was very nice. My first week in the nursing home, we sparked conversations with her, and she shed some tears, and then we got emotional as well, and it was just sweet, like, just to see how bright her face gets. Like, as soon as we walked in the room, she just lit up, and she's like, "Wow, you girls are here to help me." Like, so it was sweet.
So this kind of relates to my next question for you. How do you handle the emotional aspects of patient care?
So this is definitely something that I still kind of struggle with, because I tend to get a little too sentimental towards patients, and I don't know if it's empathetic or sympathetic, maybe a little bit of both, I'm not sure.
But you're human, so I mean, that's normal.
And for me, like, I'm the type of person that would literally give my last meal to somebody else, because that's just who I am, and I would do anything for literally a stranger on the street, which is a good thing and a bad thing sometimes. But as a nurse, you really have to show up and you have to be there all the time. And it's hard because especially with, this is like a little deeper into like something that I get very upset about.
Let's get deep.
The post-mortem care for patients, which is obviously something I haven't done yet, but I have learned about it in my fundamentals class. And I think I'm going to have a hard time with that because, like I said, I gain very deep connections with people, and especially for family aspects, like that's going to be something that I'm really going to have to like step in, and then as soon as it happens and it's done, walk out and really decompress, because that's going to be something very hard for me to do. And sometimes I think to myself, wow, can I actually do this? Because it really hits hard, especially learning about it. And not saying that my professors don't care about it, but as you get into the nursing field, you see that obviously this is something that people see all the time, and they become kind of immune to it. Which is very sad to say, but it's there every day, so it's sad to say. But my professors are very mellow with it. But one of my professors, she had a very sad death as one of her clients, one of her pediatric patients, and that's why she turned to teaching, because she couldn't deal with it in the hospital anymore. So,
oh wow! So it really
affected her. Like, she told us her name. She told us her whole story. Like, she remembers it like yesterday.
Oh wow!
So definitely the grief and the dying of nursing aspects.
I'm sure that then that hits sometimes home for people. Like, everyone has a family, so I can only imagine how hard it is to really. I don't want to say put your feelings to the side as you're entering that room with that patient.
But essentially, that's what they.
But essentially, you have to put your feelings to the side, and you're there as just their nurse, which is so, it sounds so sad saying it out loud, but that's really what you're there to do, help them with their care and everything like that, and your feelings can't get in the way of dealing with your patient, which is sad. How do you stay organized and manage your time effectively with such a packed schedule? What are your tips?
Okay, so in the beginning of the semester, I tried to use a planner.
Okay.
I feel
those are good to use, though.
But towards the middle of the semester,
you probably gave up.
Yeah, because
I know. I have a planner, and I probably haven't used it in the last 2 months.
If you see the syllabus that we get for like one certain class, let's say, it's like 17 pages long.
So it's so much.
It's too much to write out. So I was using it at first, and it did keep me organized. But honestly, that I also then put it in my phone calendar just because it was a little quicker. And then study guides. So study guides are very important for me when I take tests. I kind of go through all my slides and I write down a very deep impact study guide, and then I study with my friends in the library, and we go through it all, and then we write it on a whiteboard in the library. We have a whole system. And it really helps us, and we all aced our finals because of that. But definitely study guides help me get a little bit more organized, because we get a lot of material, so once we have an exam, we try to like condense it a little bit, so that we put it into a study guide. This way we know we don't have to look through a bunch of different slides to be that makes you unorganized looking through all the slides. So we make it nice and organized in a Google Doc. And that's what we do.
No, those are good ways to, especially the whiteboard and getting your study group together.
And I highlight it, I mark it up.
Yeah,
it's like not even, you're not even able to read it by the time I'm done with it. But
that is so funny.
Yeah.
How do you unwind and take care of your own mental and physical health with your busy schedule? Because that's very important. I mean, I'm going to keep saying that's important because I'm in that field. Yeah. But
then I want to ask you what you do, because I think, well, too, I do go to therapy myself, so it definitely helps, because throughout the week, and I just, like, unleash it all to her at the end of the week.
Good.
So I have that. Like I said before, I try to take naps a lot, because...
rest that brain.
Yeah.
Because it's constantly working.
Yeah, so I do take naps throughout the day. I try not to sleep too much, because obviously, like, you don't want to waste any time and, like, whatever, but I do try to prioritize that a lot too. And then I do a lot of study breaks too. Like, I'll make sure, like, if I'm in the library all day, I'll make sure we, like, literally close everything, and then we'll get fresh air, we'll walk outside, whatever it is, get a snack and things like that, because you can't just read and whatever.
You can't keep going hour after hour
Yeah.
after hour after hour.
But
You have to take a break.
I do struggle with the winding down aspect because you never know when, like, should I do it or should I not? Should I rest or should I keep going? That's like the main thing, which is
But you have to really rest that brain. Even if you take a walk.
Yeah.
It doesn't have to be a 25-minute walk. It could literally be a 5-10 minute walk. Yeah. Getting that fresh air is so good for you. And think about anything else other than your nursing material. Put headphones on, listen to music, and just
music really
walk.
helps me too. Actually, that's another thing. Music, 100%.
That's a lot of people dive right into music. We actually talked about this in one of my classes, and a lot of people said music helped them, and it was all different genres. Like who said rock, which like to me that was a shock because rock would make me more nervous. Yeah. Who said like really sad music? They just like to dive into that. You know, who said country music, R&B, just all different. Everyone had different genres, religious music, but most of us all said music really
we learned something like that too, like in the hospitals, like patients can get like sensory overload, it's called, from all like the machines and noises, all that stuff. So they said like warm blankets, music, like all that stuff,
especially for kids, like those machines and noises, that's like
they're so loud,
a lot for them, and it's like
they're always going on.
I like when hospitals have like rooms decorated or things on the ceiling.
Yeah, that's a big thing too, because recently I had saw a pediatrics office, and it was so old and dingy in there. And I said to myself, if I was a little kid again, going into this doctor's office, I would be so scared.
I'd probably be petrified.
I remember our pediatrician had, like, stickers all over the wall, and it was colorful in there. Like, you need...
Or bright colors. Something.
Not dark and dingy.
No. I remember, a couple years back, someone from a reality show created this, like, brand. I can't think of the name, but she created gowns, like surgical gowns with, like, characters on them for, like, pediatric patients, so that when they go into surgery, at least they have something fun on, because ORs are, like, scary.
Yeah, so, like the blue and the grippy socks. Like, who wants that?
I mean, and these are little kids that are, like, going in for sometimes long procedures.
I really like the pediatric floors. They really try to do what they can to make them feel a little bit safer.
And that's a big thing from nurses, because nurses are with the patients more than the doctor sometimes. What advice would you give to someone considering a career in nursing? What would you tell these kids entering college, finishing high school, that they want to choose nursing? Kids switching careers, what would you tell them?
I would simply say do it. It is the most rewarding thing. I mean, even though I'm just a student, and even though I'm only one semester in, it is so rewarding to learn all that. Like, it feels like a privilege to learn all of this information and to finally, like, one day be able to then apply it on someone. There will always be hard days. There were many days where I thought I couldn't do it and wanted to give up. I mean, you saw my fair share of crying sessions, but it's so rewarding, because then, like, you pass that test and you know the material, your friend will quiz you, and you're like, wow, I knew it. So I would simply say to just do it. It's so rewarding, and it's just such a special... It's a really special field, and I'm so excited to keep going through with it.
I love that. And if you're a student out there who wants to go into nursing or thinking about switching, really take that advice and go for it. And last but not least, where do you see yourself 5 years from now in your nursing career? Do you plan on branching out? What do you want to do?
So, I definitely do want to be able to branch out, because the beauty of nursing is there's so many things to do with it. So I definitely would love to start working in a hospital. I have a few different certain aspects of what I think I want to do, like field-wise, but like anything with kids or babies is really like my big thing.
Love that.
Because I like to make kids feel as comfortable as they can. Like we were saying before with the pediatric office, really bothered me. So definitely something like that. And then eventually, when the time feels right, I would want to go back to school and get and advance my degree as much as I can, because that's another beauty of nursing. You can always
just
keep going.
Keep going. Any last minute things you'd like to put out there for people listening?
I think, like I said before, if you're really thinking about it, just do it. Even if it's not nursing, even if it's something that you're so scared into going into, thinking, oh, I can't do it, I'm not smart enough, just do it. I always said to myself, oh, I can't do it. What if I, like, fail, or what if, like, I don't succeed? And, like, that was the worst thing that I could tell myself, because you can do it. And I know it sounds so cliche, but you really can do it. So
you can, as long as you put your mind to it.
Yep.
Well, thanks for joining me today on Life Unedited, Episode 3.
Episode 3.
What you said is like amazing, and I'm sure people listening are gonna really take this advice and either figure out that nursing's for them, or maybe it might not be for them, and that's perfectly okay. There's something out there for everybody.
There's something there for everyone,
and you just got to put your mind to it and keep going up that ladder, no matter what
no
career
matter the
it
field,
is.
keep going.
Yeah. Well, thank you.
Thanks for having me.
And that's a wrap on Episode 3, Life Unedited. Thank you to my sister, who absolutely did amazing with giving her insight on her nursing career in school, all the goods and all the bads within the nursing field. And she truly is amazing, and she's going to keep going up that ladder, like we said. So again, for those of you listening out there, whether you're an adult, you're a young adult, you're a kid in school, keep really pushing forward, keep going, keep ranking up that ladder. And there's something out there for everybody. And no, never give up, and keep going for what you truly believe in. Please stay tuned within this episode and the future episodes coming up. You can subscribe on YouTube at Life Unedited-2, and you can follow along on Spotify at Life Unedited. You could also check me out on Instagram at therapist_in_bloom_ for any more updates on this podcast. And I look forward to giving you next week's episode as well.